Good afternoon, everyone, and welcome to the new normal. This is a lot different than prior events, but this is going to be very, very nice. So, my name is John Barthelmess. I am the chair of the Riverbend Board of Directors, and I welcome you all here today to the 14th annual celebration of Community Champions for Mental Health. And this kicks off a month-long agenda for Riverbend and the state in celebration of mental health. And I really encourage everybody to go to the Riverbend website and look at some of the events that are scheduled. They are very, very interesting. And again, I encourage you that. The mission of Riverbend is we care for the behavioral health of our community. And in today's complicated world, I think that's really one of the most important things to all of us as we go about our daily lives. And I want to thank first the Riverbend staff of over 400 individuals whose dedication, hard work, and commitment to serving the mental health of our community. And as I speak on behalf of the Board of Directors, I want the board, the staff to know that we do recognize their efforts and we truly appreciate it, and as they go about making a difference in the lives of so many people in our catchment area. I also want to recognize the two award recipients today, Bree and Emily, for raising awareness of mental health and making a difference in our state, in your individual communities. So I congratulate you, and I wish you good luck and continue doing what you're doing. I also want to recognize the sponsors, because without their support, this event would not be possible. So as I go through, I want to thank our advocate sponsors, Concord Hospital and Janssen Pharmaceuticals, our champion sponsors, TD Bank and WB Mason. I want to thank the host for today's event, New Hampshire Healthy Families and Northeast Delta Dental. Our signature sponsors, Harvard Pilgrim and Merrimack County Savings Bank. And finally, our annual sponsors, Boris Lowe Insurance and Dartmouth Hitchcock. Joining us today is a true hero for addressing stigma surrounding mental health. John Broderick's efforts have included his role as state co-chair for Change Direction campaign, which I worked on a little bit with John, dedicated to changing the culture of mental health and mental wellness in our state. John continues to travel throughout our state, bringing his message on mental health to thousands of Granite State students. I've heard him say many times, it's the most important thing that I have ever done. And when John first, and we go back a ways, but when he first said that, I was kind of taken back a little bit, knowing that I'm talking to one of the most successful individuals in the state of New Hampshire. Among many of his accomplishments, he was the Chief Justice of the New Hampshire Supreme Court, and he went on to be the Dean and President of the UNH School of Law. But as time continued on, and I actually attended a number of events where John spoke, I finally started to get it. Because what John was doing, and what's so important, and I think what our recipients are trying to do, is make transformational change as it relates to mental health, how we view mental health, and the stigma surrounding mental health. So I look at John and I've watched him. When you make transformational change and you change a culture, you are truly doing something special. So it's my honor and my pleasure. Please join me in welcoming the former Chief Justice of the New Hampshire Supreme Court and a 2010 Champion for Mental Health Award recipient, John Broderick.
Good evening, everyone. I want to thank the chairman. He'll always be commissioner to me, but John Barthelmess and I go back a long way, and you're lucky to have him. I want to congratulate Emily and Bree tonight. It's really fitting, I think, that two young people at their relative ages are being honored here tonight as champions of change in mental health, because it's their generation that will change it. I'm a baby boomer, not that you could have ever guessed that. And I come from a world, by the way, where no one talked about it. No one understood it. People hid it, by the way. That was the goal, not to share it. And so that I'm candid, that was probably me too, until it struck my own family. And I didn't see it for what it was. I made mistakes. But through the grace of God and skill of a lot of good people, my family made it through. And from that experience, and with the blessing of my family, especially my son, I've devoted the last 4+ years of my life, with the help and support of Dartmouth Hitchcock, by the way, where I now work, to speaking wherever I'm asked on mental illness. I've spoken over 520 times before COVID hit. I spent a lot of times in middle schools and high schools. I would speak every single day if I had the opportunity, because I see it now. I met Emily through my mental health travels. She was one of the leaders of the Youth Summit that Dartmouth Hitchcock hosted a year ago, April. She was a facilitator and one of the young people who summarized their recommendations. And when you meet her, you know she's a rock star. She really is. She's an exceptional young woman. She may be 17, but she's 35 in every other way. And Bree, who's being honored tonight for her video, which made a huge impact on me at that youth summit, they're involved in an effort to destigmatize mental illness, to start a conversation that we have too long delayed in the United States. We've come a long way on cancer. My mother used to whisper that word, by the way. No one talked about AIDS in the early 80s. That was shameful. Seems silly now. And mental illness, for whatever reason, has always been lagging. The number 2 physician in psychiatry at Dartmouth Hitchcock, a man I respect, he's in his late 50s, a graduate of Harvard Medical School. He was asked at a public forum for 99 Faces, which Emily was great to participate in, how he would rate the mental health system in the United States, November 2019. He said, that's a very interesting question. Let me answer it this way. The way we treat breast cancer today, not 30 years ago, today, is pretty close to a 10 on a 10-point scale. It's mostly, but not exclusively, women. We get them in early. We have very good protocols. We're seeing much success. A lot of those women who died when I was a kid in their early 40s are now living a full life expectancy. He said, I would rate the way we treat breast cancer today as pretty close to a 10 on a 10-point scale. On that same 10-point scale, he said, I would rate the way we treat mental illness as a system in the country as maybe a 1 or a 2. November 2019. Bree and Emily and their generation, by the way, I love your generation. I really mean that. You are so willing to talk and change. They understand that. And their honor here tonight is a recognition of their courage, but also a recognition of the urgency of this matter. We hear young people mostly now speaking loudly about climate change, and older people are starting to listen. We need more young voices, and we need more older listeners, and we need to be open to change. So I'm delighted to be here. I'm really proud to be a small part of this and to congratulate both of them, because you are making a difference in the lives of people, some of whom you will never meet. And hopefully, when we gather here 20 years now, down the road, I may not be here then, but I'll be with you in spirit. Hopefully this issue will look different than it does now. People say, was it really like that at one point? People still stigmatize mental illness. I'm confident your generation will make that change. And so my congratulations to both of you for this real honor tonight. Thank you very much.
Thank you very much for your comments. It's always wonderful to hear your stories and to share your knowledge and your strength with everybody, so it's greatly appreciated. I also want to thank all of our sponsors for supporting us during this event. Without them, as John had said, we wouldn't be able to proceed. I'd like to introduce myself. My name is Lisa Madden. I am the president and CEO of Riverbend. And as you may know, Riverbend is a community mental health center that has been providing critical mental illness and addiction services for over 50 years. We serve the greater Concord community and collaborate with our sister organizations throughout the state of New Hampshire. We do provide a wide range of services: inpatient, outpatient, emergency services, residential care. But I'd like to highlight a few new initiatives that are especially important during this time of COVID, and I think are also telling about our efforts to really look to embrace the needs of our young people. One such program is the Youth Suicide Prevention Project. In partnership with NAMI New Hampshire and the Public Health Network, Riverbend has hired a person who will work within our community with the goal of reducing suicide incidents among our youth and young adults ages 10 to 24. This professional will meet with high-risk youth and their families to develop crisis plans, provide education, and connect them with Riverbend and community resources. They will also strengthen the cross-systems collaboration, improve the pathways to care, and offer comprehensive training opportunities to organizations, the clients, and the community throughout. We also have a newly developed rapid response team. This is directly in response to COVID-19, and the Mental Health Association has been grant funded to support an increase in staffing to prepare the community mental health centers for the anticipated mental health surge. And for those who are not aware of where we are with that, we are very much involved in a mental health surge at this point, with a tremendous increase in requests for services, both inpatient and outpatient. The positions on the rapid response team include a crisis clinician and a peer support specialist. This team will work with Concord Emergency Department and the Behavioral Health Unit located at 5 West at Concord Hospital to ensure a client's successful connection to the Crisis Treatment Center, the Doorway, which is a program available for substance use disordered services, and other Riverbend resources. This position will also support healthcare workers experiencing a mental health crisis in our community to connect them with long-term mental health services. This program has already proven to be extremely effective, and we have been working with first responders and with other healthcare workers who are very fatigued with the current state of affairs and with COVID. So it's been a very valuable program. And also I'd like to tell you about the trauma-informed care in the emergency department. The Behavioral Health Clinical Learning Collaborative and Riverbend are participating in a pilot project to train staff on trauma-informed care principles and implement an individualized training and strategy within Concord Hospital's emergency department. Training will engage teams of emergency department staff and Riverbend Emergency Services staff to understand foundational and practical utilization of trauma-informed techniques in our local emergency department. The hope and the goal here is that if we can really teach people how to respond in a trauma-informed manner, then people can feel heard, welcomed into a treatment environment, and successfully engage in a recovery plan. All of these programs are designed to help people in crisis and develop plans for their recovery. As others have mentioned, this is the 14th annual Champions for Mental Health and the kickoff to a month-long celebration in honor of mental health awareness. Typically, we would all be gathered in a crowded room, sharing stories, catching up, and celebrating in person. But as we know, 2020 is anything but typical, and our champions this year aren't typical either, nor we are very excited about that. It brings in a new generation of voices that we are eager to hear. These two remarkable people are in the beginning of what I expect to be a lifelong advocacy to normalize the conversation around mental illness. Open about their own mental health struggles, and they are keenly known importance of creating a culture where youth feel safe and supported to discuss mental health, particularly in schools. They are truly living into the motto, be the change you want to see. So now I get the honor of introducing you to our champions. First is Brielle, or Bree, Paquette. Bree is an 18-year-old from southern region of New Hampshire. As you will see in the video, her drive and ambition for public speaking and educating others on the issues of mental health grows every day. Please join me in watching the video.
Well, I grew up in a very unstable household. My dad has been an on and off drug user and an alcoholic since he was 14 years old. And my mom struggles from awful anxiety, diagnosed depression. And I started going through I got diagnosed with really high anxiety in 7th grade, and I've been working with it ever since then. And it's hard. I didn't want to talk about it, not to my brother, no one. I wanted to do it all on my own. There was actually this one specific girl who was in my class, and I started asking her, like, what do you do for fun? Like, I see that you draw a lot. Like, do you like drawing? And, you know, she started slowly talking to me about things, and I ended up saying, like, oh, like, you know, if you ever need to talk to anyone, like, I know that we may not have talked before, but, like, you can talk to me about things. And she just started crying in class, and right there, like, I just hugged her. If someone just hugged me, like, my teacher would bring me to the hall and just hug me. And it would just make me feel so safe and so loved and secure. And it was so random. I was just sitting there and I was just like, I think I want to go to Boston and blindfold myself and let people hug me.
Me having thoughts of suicide, and then that, of course.
Too much is wrong.
And it was always that fear in the back of
How many times I wanted to just give up? How many times I've thought about ending it?
I made the sign that said 20 to 50% of adolescents struggle with mental health issues. Hug to show support for those who are struggling. And at first, no one really hugged me. My mom was kind of like, I don't think this is working. People were just walking by and kind of giving me dirty looks and being like, what is this girl doing? And then this one lady came up to me. She whispered in my ear. She's like, I haven't seen anyone hug you yet, but I'm gonna give you the biggest hug ever. And she hugged me. And from that point on, it was like a domino effect. Seeing how everyone was reacting, the positive feedback I was getting, it just sparked something in me. I was just like, this is insane. Like, I didn't know what I could do. And then I was just like, I want to take this 5 steps further. And I created a platform called You Are Not Alone, Changing the Stigma of Mental Health. And I work to encourage people in my community to feel comfortable talking about the situations they face at. I like to say it's more changing the perspective of how we look at it, because anxiety, depression, it's never gonna go away. It's, you know, it's life. Life can get really challenging, and it will never be all sunshine and rainbows. Like, you're gonna have points in your life where you feel down. It's more about changing that. That's okay to feel like that, and just because you feel down doesn't mean you're stuck there. It became such an obsession of just wanting to use my voice in any way I can, because now I'm so confident and just want to help anyone I can. And he hugged me for a very long time. He was probably my longest hug. And he just held on to me in this way, like, that he didn't say anything, he just held on to me. It was just like, it felt like, just like that feeling of like, thank you, like, thank you for doing this. Just showing that you're there and showing love and support for them can make all the difference.
The problem people do, just don't give up. You can't give up. It can get hard, it can get tough, and it can get so exhausting, and I understand, but you just have to keep going.
Excellent. Please, come on up, please. It's my honor to present you with this champion award. Congratulations.
Oh, this is so cool. Thank you so much. Am I allowed to take off my mask? Okay. Thank you. Thank you for that video. That was amazing. I love that. Thank you so much. I first want to say thank you to Riverbend for giving me the opportunity to accept this award. I truly can't even explain how much it means to me. When Deli first gave me the call that I won this award, I since then I have been on cloud nine. I have been walking around like I have been floating. And the more I thought about it, the more I just thought it was so crazy that I'm getting an award for something that I just love doing and I'm so passionate about. You know, I grew up, as you can see by the video, that I grew up around mental illness, and it wasn't until just a few years ago I realized how much mental illness is really around us. Like, we're all in this room right now, and we have people to the left of us and the right of us, but we don't really know what they've gone through or what they're feeling right now or maybe 3 hours ago. And I think that's because people hide it, and like John was saying, and you know, it's not, mental illness isn't always, it's most of the time not visible. And my whole platform is about making it okay to talk about it, and that you don't have to hide it, and it's not something that's shameful to look upon, and that a lot of people go through. And I'm so thankful for this award. Thank you so much. Safety first.
Okay, our second recipient tonight is Emily Galeva. Emily is a 17-year-old from the Upper Valley. She could see firsthand how her peers were struggling with mental health issues and became determined to raise awareness and address the stigma that prevents students from getting help. Let's please see her video.
And mental health was always just something that was kind of lingering and out there, that's something people didn't really talk about. And I didn't even realize that I had my own issues involving mental health, just because I am originally from Bulgaria. And there it's kind of like bullheaded. A lot of people like to say you have issues, but you don't talk about them, you know. There was a huge storm, and like I basically flipped in the boat and I drowned. Yeah, and they brought me back and I got hypothermia and a lot of water in my lungs, and it was a very, very, very scary experience. But it completely changed how I think about life and how I view mentality and what is actually important in life. And it made me realize how so many things in life just that I've been focusing on are not important. It made me change myself and how I acted, and that changed how others view me, and it basically led to the help that I needed to get. My depression wasn't feeling sad all the time or wanting to kill myself all the time. It was being bored with life. It was not wanting to get out of bed. It was very hard to go to school. I originally didn't want to go to a therapist. I didn't want to be viewed as a kid who goes to therapy. So I actually refused for a while to go to therapy, and I realized that was the wrong choice. In school, when someone says, "How are you doing?" it's such a natural response for kids to say, "Oh, good, how are you?" or "I'm fine." But they're not fine. You have to change the question and ask, "How's your mental health?" I believe that everyone needs a therapist. The only people that don't need therapists are the people who have been going to therapy long enough to know that they don't need a therapist. Because it is reassuring you that you are doing the right thing, that you're on the right path. And it's very nice to have reassurance, especially as kids. That's something we've been growing up with all our lives, reassurance. 1 + 1 = 2. Does this equal 2, teacher? Yes, this equals 2. It's reassurance to know that you're doing the right thing, and that's what a therapist can provide, reassurance. He was expressing at least anger, which once again I don't think is real. I think it's a form of sadness. But he was actually expressing something versus holding it in and saying, "Nothing, nothing, nothing, I don't care, I don't feel anything." And that was the biggest change that I saw, was from going blank to actually feeling something. Because he was just trying to, I think, put a wall up and not feel anything. And someone needed to reach over the wall and pull him over it and say, "It's okay." Any kids that are going through anything, I'd like to just tell them you will get through it, whatever you're going through, as long as you keep going, because you never know how life is gonna spin around. There are things that will happen to you that maybe you don't like or that maybe make you sad, but it's not the events that define you. It's not the events that happen to you that define you. What defines you is how you deal with it and how you come out of it.
Emily, I invite you up to receive your award.
Thank you so much.
Congratulations.
All right, so first I'll take my mask off. And I have a few things written on my phone that I just wanted to say. So first of all, thank you for the video and thank you for the lovely introduction. I'm Emily Galeva, and I appreciate everyone coming today. I'm so grateful and honored to be receiving this award. And I wanted to thank the Girl Scouts organization especially just for opening up so many opportunities for me at such a young age. I'm only 17, and I didn't join the Girl Scouts knowing that I was going to do any of this. I was just thinking, I'm gonna be selling cookies, great. I'm gonna get to eat cookies, that's awesome. And it just led to so many more things that I could never even have seen coming, and it led me here. So I've used the title as a Girl Scout to build my own confidence and bring importance to myself as a person. And what I mean by this is that I'm only a high schooler. It was very nerve-wracking to be talking to established adults who had titles and had done important things in their lives when I haven't done that much. I was very nervous, high anxiety to do this. And through the Girl Scouts, it gave me a platform to introduce myself and feel less anxious about it. I felt that I didn't really have much to showcase about myself since I'm not well known, but when I mentioned that I was a Girl Scout, it started a connection and it started a conversation. So it really helped me in basically just talking to people and continuing with my project. Girl Scouts built my leadership skills, which made it a lot easier for people to see and recognize my work, and I would definitely encourage anyone and everyone to join, and I would press parents to enlist their kids into going into Girl Scouts, because no, it is not just selling cookies. And I wanted to especially thank my support group, which includes my parents, Sue Henderson, who was my former troop leader, John Broderick, my teachers, Leah McGrath, and Karen Borgstorm. Thank you for this award.
Very impressive. I just want to offer my personal congratulations to both of you as two young women who are just getting started on whatever you choose to do for your careers. I hope this passion stays with you, and you have the ability to do amazing things and to change the world around you. And we'd also just say, whenever you feel that sense of fatigue or tiredness that comes, because it will, this is a hard work that we do, make sure you surround yourselves with happiness and loving and caring people to continue to support you, because you're going to do great things. And you already have. Even if you are young, you already have. So congratulations. I want to thank everyone for your support this evening. I hope you'll join us at other events this month in the celebration of mental health awareness. A full calendar of workshops, panel discussions, book discussions, an art exhibit, and the airing of This Is My Brave, another phenomenal series and an episode in which people who have lived with mental illness tell their story in a very compelling and compassionate manner. This can all be found on our website, which is riverbendcmhc.org. And finally, I'd like to give another round of applause to our champions, and thank you very much for coming.